All right, hello. My name is Tiffany, and today I'm going to be going over one of the upper respiratory illnesses, commonly known as asthma. What asthma is that it's a long term condition that does affect the lungs, and makes it harder to breathe. So this happens when the airways become swollen, tight, and filled with mucus. So people with asthma may cough, wheeze, or feel short of breath, and these symptoms can come and go and are often triggered by things like dust, cold air, allergies, and exercise. So asthma is very common and it does affect millions around the world. So the experiences of asthma can range from mild symptoms to more severe and frequent breathing problems. So down here, as you can see, it's comparing a normal airway to an asthmatic airway, and you can see there's tightened muscles in the bronchospasm. There's also inflammation, there's a thick mucus production, and there's constriction. As you can see in the normal airway, there's no mucus, no constriction, no kind of inflammation. So the three major parts that are affected by asthma is the trachea. So this is also known as the windpipe and is a larger tube in the body that carries the air to the lungs. So this is formed by firm cartilage rings. So it doesn't fully collapse, but with asthma, it is going to tighten. Then you have the bronchi, which are the larger branches of the lungs that come off of the trachea. And these also become tightened and swollen, and this is going to restrict airflow. Then you have the bronchioles, and these are just the smaller airways, and they're the most affected with asthma since they are smaller and located deeper in the lung. These are going to narrow and constrict and filled with mucus, and this is what's going to cause the bigger breathing problems. So as you can see down here, a fully dilated broncholi, 100% open, no inflammation, no mucus, no anything is visible. And then someone with asthma who's experiencing an episode, there's going to be a 20% diameter reduction as you can compare these two. And then looking at the normal breathing to the asthma emergency, it's at a 50% diameter reduction. And you can see the inflammation and the constriction here. And again, this is also showing normal bronchi tube to an inflamed. You can see that there is a big difference between the two of them. So pathophysiology of asthma. So in the body, the airways are going to tighten. This is going to make it harder to breathe. There's also going to be presence of swelling and inflammation. This is going to also make it hard for air to pass through. There's also presence of mucus in the lungs, and this is going to become thick and is also going to block the airways. So what causes asthma to be a long-term issue in patients is with the constant inflammation scarring in the airways. Uh, as it is possible, it causes the airways to become thicker and stiffer, and the constant scarring of this problem is just going to stay in the body, making it more difficult to be able to relieve this issue, making it a chronic diagnosis. And again, you can compare normal airway to an asthmatic airway. You see how the walls are inflamed and thicken. These muscles are tighten and constrict. And then here again, you have a healthy airway comparing it to a severe asthmatic patient. So you're going to see that there's again the inflammation, the mucus on the inside. So to compare the two once again. So diagnosis can look are very similar, but there's also a couple of different tests that can be done. So the main one that's going to be done is the spirometry test. So this is done by blowing into a tube just to see how much air can be pushed through and how fast it can be done. So this is typically done before and after the use of an inhaler to see how much improvement is done with a patient with the use of that inhaler. And then you also have the bronchodilator test. So the patient's going to take medication that's going to help open the airways, and then the test is going to be repeated. And if the breathing has improved immensely, it's strongly going to support the diagnosis of asthma. And things that can be done at home is something called the peak flow meter. So this is just a handheld device that's just used to measure how fast you can breathe out. And this is to track daily changes. So doctors are also going to use a medical history, ask about symptoms and triggers. They're going to listen to the lungs, possibly do some allergy testings to see if the triggers are common things like dust and pollen. And then if diagnosis is still unclear, x-rays will be done to kind of visualize and see if there is any asthma type symptoms in the body. especially like in the chest lung area, along with the throat. So this is an example of what the diagnostic equipment looks like. So you might have seen something like this either at a Walgreens or a Walmart. So you're going to have the mouthpiece that you'll blow into, and this is going to kind of like determine how much air you're able to breathe in or breathe out. And then this is the peak flow meter, and this is what can be done at the house as well. So as for treatment and prognosis, so every asthma patient is going to have something different but also similar. So a lot of people have things like daily controller inhalers that's going to help reduce swelling and inflammation. So these are going to be your inhaled corticosteroids. So you're looking at things like fluticasone, budesonide, and mometasone. These are some that are commonly used. There's also things called the leukotriene modifiers. So these are oral pills like the montelukast and the Zileuton. And then there's also sometimes when the asthma is very severe and people are going to be using combined inhalers, such as a fluticasone salmeterol inhaler or a budesonide formoterol combined inhalers. There's also, some medical treatments there are some non-medical treatments that you can use to kind of prevent an asthmatic attack, like not smoking, and then trying to avoid dust and pollen as much as you can. So asthma flare-ups can be prevented and managed. The patient is just going to have to follow a asthma action plan and being able to recognize early signs of flare-ups and then taking medications as prescribed is really going to help this. So these are just examples of what these look like. So this is the fluticasone. They also have fluticasone in a powder form, a couple of different kind of inhalers that I didn't mention. But these are just some examples of what can be used in asthmatic patients. So one of the articles that I did enjoy reading is kind of just highlighted how asthma results from different types of things like genetics and environmental factors that are going to be affecting the lungs. So there are a couple key genes like the GSDMB and the TSLP that do influence airway inflammation, the smooth muscle tightening, and mucus overproduction. While there's also things that are environmental like the maternal smoking, excess or prematurity, and vitamin deficiencies that can also shape the risk of asthma. So these changes can lead to airway narrowing, excessive mucus, and long-term remodeling. This is going to cause asthmatic symptoms like the wheezing, the coughing, shortness of breath. And so while the study that was done clarifies that there are several genetic factors and environmental factors, there's still questions that remain about what the exact mechanism behind airway hyperreactivity and why some patients do develop permanent airway changes. So I think that by understanding these processes, it is going to be essential for improving personalized asthma treatments and prevention strategies. So again, asthma is a very common chronic lung condition that does affect millions across the world. Again, it's the inflamed airways. The symptoms that you're going to notice are the wheezing, the coughing, tightness in the chest. So diagnosis is going to be done by those lung functioning tests, like I mentioned, the peak flow meter, the spirometry test. There's also effective management that is combined with avoiding triggers, and then using things such as inhalers, like the corticosteroids, and then following like a personalized asthma action plan. So by regularly monitoring the patient education and adhering to the treatment plan is going to be essential for keeping these symptoms under control and maintain normal lung function. So by working with a care team, most people are able to live with asthma. They're able to live an active, healthy life while minimizing complications. And then this is my references. And for the peer review article, it is the first one that is here. Thank you.